Good morning. Good morning. Welcome to the New Hampshire Hospital Association. My name is Steve Annan, President of the Hospital Association. I'm pleased to welcome you all here today. We just finished a very productive and I believe helpful briefing from our state officials, with our congressional delegation and many others. So I'm going to turn this now over to Senator Shaheen for some additional discussions. Senator Shaheen.
Thank you very much, Steve, and thank you to the Hospital Association for hosting us. I think it's a really important message for everyone in New Hampshire that the entire congressional delegation, the governor, and state officials are here to talk about what the state and federal response is to the coronavirus. And obviously, we want to work very closely together to do everything we can to address the potential threat here. Everybody's going to just speak briefly so we have plenty of time to answer questions. And let me also say how pleased we are to have Commissioner Shibinette here, Dr. Chan, who is the state epidemiologist, and folks from a number of hospital systems and from both Nashua and Manchester Public Health. Thank you all very much for joining us. The meeting we had was very informative. As we know, much is still unknown about the coronavirus, but we want to make sure that the public stays informed and that we work together to get as much information as we can out. There were a number of points that were made, mostly both the New Hampshire Department of Health and Human Services and the U.S. Centers for Disease Control and Prevention websites have information on the virus and what precautions should be taken, and we want to make sure that the public knows that those are available and should look at those as often as possible if you have questions. Now, those resources include best practices for hygiene for you and your family. There are important reminders to stay home when you're sick, to seek guidance if you're traveling someplace, and in particular, anyone who has traveled to an area where the virus has spread and is experiencing symptoms, go to your doctor as soon as possible and be tested. I and the rest of the delegation, Senator Hassan, Congresswoman Custer, Congressman Pappas, have been working in Washington to try and make sure that the resources that New Hampshire needs are available, and we intend to continue doing that to try and we hope to have supplemental budget appropriation going through this week. Congresswoman Custer will speak to that in greater detail. And we are encouraging the administration to work very closely with officials at the state and local level, and to recognize for all of us that it is science that should be driving our response on this virus, and hopefully we will see that in all of the response. Now, we are also asking that any federal legislation reimburse the state, not just for money already expended, but for future potential costs. We think that's very important, not just for New Hampshire, but for all of the states. And again, I want to thank everyone who is here today for all of the work that you are doing on a daily basis. We will continue to work together to make sure that we do everything possible to address the public concern and address the need to respond to the coronavirus outbreak in a bipartisan manner. So thank you all. I'm pleased that Senator Hassan is going to be speaking next.
Well, thank you, Senator Shaheen, and thanks again to Steve Annan and the New Hampshire Hospital Association for hosting us, and to all of the excellent public health officials who are here with us this morning. Thank you for the briefing. Thank you for the work you and your teams are doing. As Senator Shaheen mentioned, we just finished this briefing with state officials on the response to the coronavirus, and we need to continue to communicate with each other, but also to the public, because obviously this is a public health challenge that we all need to take very seriously. The single best thing for the public to do right now is to continue to follow typical flu prevention measures, including washing your hands often, avoiding touching your eyes, mouth, or nose with unwashed hands, and avoid close contact with people who are sick. In addition, anyone who has traveled to a country where the coronavirus has spread and is experiencing cold-like symptoms should immediately call your medical provider, and if they recommend coming in, come in to seek medical attention, and provide your provider with your recent travel information. We're going to continue as a delegation to work across the aisle with members of Congress to provide the emergency resources that we need and to ensure that the administration is effectively coordinating with all levels of government. I'm very grateful for the relationship with Governor Sununu and his office as we all come together to work to combat this challenge. Members of both parties in Washington agreed that the administration's $2.5 billion funding request will not be sufficient, and bipartisan efforts are underway to write an emergency supplemental funding bill. As a member of the Senate Health, Education, Labor, and Pensions Committee, as well as the Homeland Security and Governmental Affairs Committee, I've participated in a number of briefings on the response to the outbreak. This week, I'll be in 3 hearings in these committees where I'll continue to question federal officials to determine what additional resources are needed and to communicate what our state folks are telling us they need and ensure that the administration is effectively coordinating with our state and local governments. I am grateful for the work of all the public health officials here in New Hampshire and across the country who are preparing for the potential impacts of this virus, and very, very grateful again for the communication that we can do in this, as Beth Daly communicated earlier, our small and mighty state. We can talk with each other and we can get things done, and I'm confident we'll continue to do that. And now I'll turn it over to the governor.
Great. Thank you, Senators. Well, thank you very much. First and foremost, just want to start by thanking our team at Health and Human Services, Lori Shiburnett, Dr. Chan, Lisa Morris. The entire team has really been putting a lot of hours in for the past few weeks, really going over and above, and so we can't thank them enough. Also, the federal delegation up and down the line has been absolutely terrific. I think they've done an exceptional job, not just communicating what's happening in Washington with the CDC, fighting for resources, but even working with us in terms of communication at a very regional and localized level with any of the incidences that may be coming up and the concerns at a local level. I think they've just done a fantastic job. The most important message that we can get out is the state is prepared. We know that the risk level does remain low, but we are prepared and we are going to remain prepared to deal with any issue that might arise as this public health situation continues to develop. We don't know exactly how it's going to develop in the next few weeks, but it is an all-hands-on-deck effort, and we very much stand prepared. Our job at the state level is really to operationalize at a very localized level, sometimes community to community, school to school, family to family, individual to individual, the opportunity and the resources that are coming down from the federal level. And the most important thing we can do is with clear communication and coordination, again, at that very localized level. There will be a series of regularly scheduled calls and meetings that as we go forward a few times a week so that, again, everybody has that information. That doesn't just happen at the state level. It will be done everything with school districts, with local community officials that are in charge of their local health networks, as well as up the chain at the federal level. I'll be speaking with the Vice President and other governors later today to talk about what's happening in other states and what we're seeing more at a nationalized level. So the opportunity is there. Communication is the most important tool that we have in terms of getting through this issue as we move forward. With that, I'm going to turn it over to Congressman Custer.
Thank you. Thank you very much, Governor, and thank you to the senators and to my colleague Chris Pappas. The coordination is very important, and particularly as we're working this week on the supplemental appropriation. And I want to thank the team from the state for working with us. Thank you to Dr. Benjamin Chen for your wisdom and guidance, and to Commissioner Shiburnett for keeping us on track. I want to particularly call out Lisa Morris, the Director of Public Health, who was in Washington last week and was able to meet with us and meet with authorities to give us guidance on this appropriation. So we anticipate that the supplemental appropriation will be coming to the floor of the House this week. And everyone is working together, Republicans and Democrats, trying to get to the right number to right size the response to this. What we want to convey to people is to remain calm, stay calm, and wash your hands. That's the main message, that most people will not be dramatically impacted, but it is important that you can take steps yourself to keep you and your family safe. Some people will have a more serious response, and I think, as the governor said, we are prepared for that. We're fortunate living in a small state where we can all work together, and there will be some instances where people will stay home from school or be isolated from the community so as not to spread the illness. I think what's important in New Hampshire is that we have the resources to do that. And so, as we've repeated over and over, take the steps for your own personal hygiene, for those around you. If you're not feeling well, please do not come to work, and so that we reduce the exposure. But if you have symptoms, including a fever, coughing, of illness, then reach out to your physician or your medical personnel. Call first, and they will instruct you as to the next steps. We will be on top of this to get the appropriation over to the Senate. The Senate will respond quickly, obviously. We're fortunate to have our senators in important positions there to make this happen. And then we will continue. I serve on the House Energy and Commerce Health Subcommittee. We were briefed last week by Secretary Azar. We have been briefed as a whole House several times now on this coronavirus. And our goal is to make sure that we communicate clearly to our constituents. So we'll be doing that through videos and newsletters and hopefully planning a telephone town hall, but just to keep everyone in the loop with the most up-to-date information possible. And with that, I'll turn it over to my colleague, Chris Pappas.
Thank you very much to my colleague Annie Kuster and to Senators Hassan and Shaheen and Governor Sununu as well for being here. The briefing today was thorough as we heard about the state's efforts to respond to this. So we certainly want to really just say that the folks at Health and Human Services have done a wonderful job at making sure that information gets out there to the public in an appropriate fashion. As the state looks at containment and mitigation of this, if this does continue to appear in New Hampshire, we want to make sure that we provide all the federal resources necessary so that can be a complete response that looks to protect public health. So as the public continues to hear about this in the media, it's important that we listen to those voices in the public health community to ensure that we're taking all the steps we can to protect ourselves. One of the places that I've looked as chair of the Oversight Investigation Subcommittee for the Veterans Affairs Committee in the House has been communicating with VA, which is our nation's largest healthcare system, to make sure that VA is well equipped to deal with this. I was on the phone this morning with the director of the Manchester VA. They are well stocked in terms of masks and gowns. They're communicating well with their regional partners out of Boston, and they feel that they're well prepared to follow the action plans that have been in place for a long period of time. So for VA and all of our healthcare facilities around the state, for our hospitals, I know they're all continuing to look for ways to work together to make sure that we can all pull in the same direction as this continues to present itself in New Hampshire. So there is deep concern across our state. We all need to be calm, cool, and collected as we respond to this, to listen to our public health officials and make sure, the bottom line is out of Washington, that we get the resources we need to continue to allow these efforts to go forward. And I know that the delegation is eager to get back there to get the job done this week. So with that, I think we'll turn things over to Dr. Chan for some remarks.
Good morning, everyone. Thank you all for being here. And let me first start by saying thank you to our congressional delegation for helping to organize this meeting. Also, thank you to the governor's office and the other state agencies who have been a tremendous support to public health in our response to this newly emerging coronavirus. I also want to be sure to thank the frontline staff within public health and the other agencies who have been working tirelessly 24/7 nights and weekends to respond to concerns, answer phone calls, and try and get the information out there on how best to protect ourselves from this newly emerging coronavirus that we're calling COVID-19. So as many of you may be aware, we released a notice yesterday that we were testing a fourth person for COVID-19. That's the disease caused by this novel coronavirus that first was identified originating out of Wuhan City, China, about 2 months ago. This is the fourth individual in New Hampshire that we have tested. The prior 3 have been negative. And unfortunately, I am here to tell you that that fourth test is positive. So our public health laboratory has brought on the capacity to do COVID-19 testing as of this morning. This individual is an adult from Grafton County. They are not hospitalized. They are currently on home isolation and are not sick enough to be hospitalized. And we will be working very closely with healthcare providers in the community and the hospital system involved in order to investigate this case of COVID-19 and try and prevent further transmission in our community. I will also mention that this is an individual who had recently traveled to Italy. This is not an instance we believe that represents wider spread community transmission. And so our public health agency, with support of multiple other state agencies and the governor's office and the congressional delegation, will be working tirelessly to investigate this most recent identification and to identify any potential susceptible contacts who may need to themselves be placed under self-quarantine. We have been asked multiple times, are we prepared for the introduction of this novel coronavirus in New Hampshire? And I want to say yes. This is part of the core public health work that we do. We have responded to multiple similar infectious disease threats over the years to even decades, thinking of SARS coronavirus in 2002, the H1N1 pandemic in 2009, MERS coronavirus in 2012, Ebola virus disease that emerged in the United States back in 2014 and 2015. So we have a rich history and experience of responding to these types of infectious disease threats. Any new or emerging virus or pathogen like this obviously presents its own challenges, and we will continue to work with our state agencies and local partners and healthcare providers to respond to this newest challenge. But I have every confidence in our staff to be able to appropriately investigate to try and prevent further spread in our communities. I will end by just saying that if and when this virus becomes more widespread in the United States or even in New Hampshire, that it is important for everybody in our communities to take the proper infection control steps to prevent transmission not only of this new virus, but of any virus that can be circulating this time of year, including viruses like influenza. So we ask people that if they are sick, that they stay home, they do not go to school or work, especially if they have a fever or respiratory illness. People should be practicing frequent hand hygiene. People that are coughing and sneezing should be appropriately covering those coughs and sneezes and then washing their hands afterwards. And if anybody is sick, we encourage them to call ahead to their healthcare providers to talk about their symptoms and any potential travel. And we will continue to work closely with our healthcare providers and our healthcare systems to address concerns and issues that arise around this new virus. So with that, let me say thank you and turn things back over. Thank you.
Well, thank you very much. I think any of us would be happy to answer questions. And we have the state officials here from public health who are also able to answer questions. Yes.
For Dr. Chan, can you tell us the fourth person who
you should come up so we can get
was apparently an employee at Dartmouth-Hitchcock Medical Center. Can you tell us, was this person in contact with patients, and if so, are there other people being held in quarantine right now as a risk of transmitting?
Yeah. So let me start by saying that our ability for the public health lab to test is considered a presumptive positive. This individual and this test still needs to be confirmed at the Centers for Disease Control and Prevention, but we are not going to wait for that confirmation. We are going to be beginning the investigation. In fact, we already have begun the investigation when we initiated testing over the weekend. So we will be working very closely with the healthcare agency involved in this, but at this time we're not releasing more information. This is an active, ongoing investigation, and we need to work very closely with our healthcare partners to get the correct information and identify whether other patients or other healthcare workers or other people in the community even may have been exposed, so that we can appropriately reach out to those individuals and make sure that they are self-quarantining and out of the public setting, so that this virus does not spread further.
Could you tell us a little bit about Dartmouth-Hitchcock and whether this suspected patient was in the proximity of the hospital?
So I would defer you to questions about that to Dartmouth-Hitchcock Medical Center.
And let me just point out, Dr. Janet Conroy is here, so she might be able to answer some of those questions.
Can you answer that question?
Well, I'll just tell you that we
Go to the microphone, please. Sorry. Yeah.
Just introduce yourself.
Joanne Conroy, I'm the CEO of Dartmouth-Hitchcock Health. So there was a lot of organization this weekend, really just to identify anybody that's been in contact with the individual who's under investigation for potentially being positive after the CDC confirms the presumptive positive test. We stood up incident command this morning at 9 a.m. and are going through the processes of not only figuring out how to reach out to the individuals that may have had contact with this individual, but much more broadly, how do we address concerns of the public? We know that there will be a response to this from the public, and how do we answer their questions both from an inpatient and an outpatient setting, and all of that will be forthcoming.
Quickly, Dr. Conroy, can you just describe the process that goes on when you do set up an incident command? Just in the limited reading that I've done, it sounds like when hospitals have a situation like this, you almost have to designate an entire wing of a building as being a spot where this can happen, or just describe what's going on.
We do have a large conference room that is our incident command. Many of you that may have covered our shooting that we had in 2017 understand that we did set up incident command at that time as well to really address the concerns both for employees as well as the public and coordinate the efforts of all the police departments that were involved in that. We set up incident command for anything that's going to present a risk to the patients, the employees of the institution, and or the public. It involves probably 20 individuals with their areas of expertise specific to the issue that we're addressing. And there is a very, very structured way that they develop what are near-term issues we need to address, what are long-term issues we need to address in order to protect the public.
Dr. Conroy, can you confirm that the presumptive positive is a employee of Dartmouth-Hitchcock rather than a patient?
The presumptive positive is an employee of Dartmouth-Hitchcock. We informed our staff of that last night and our board members this morning.
And Dr. Chen, can you talk about how the test was initiated, like the symptoms of this particular individual?
Yeah, thank you. Good question. The question was about the symptoms of the individual. So I'm limited in what information I can release on an individual level. I will say that this individual had more mild symptoms. They were not sick enough to require hospitalization, and they're currently under self-isolation at home. Symptoms of COVID-19 disease, a majority of people typically present with either fever and some type of respiratory illness. Oftentimes that's cough or shortness of breath. And I'm sorry, you had another part to that question.
How was the test initiated?
Yes.
Why was it initiated?
So the system worked appropriately, and as we have requested of healthcare providers, this is an individual who went into their provider with symptoms of fever or respiratory illness after travel to Italy. We were appropriately notified and initiated testing on Saturday. We worked with Dartmouth-Hitchcock Medical Center to collect samples under appropriate protective equipment on this individual. Those samples were then shipped to the New Hampshire Public Health Laboratory. We initiated some preliminary testing on Sunday. Initial tests that we were able to run at that time included influenza and a test that looks for a variety of other commonly circulating viral pathogens. Those preliminary tests were negative, and so when we brought the COVID-19 test on this morning, we ran the patient specimens for COVID-19, and those returned just an hour or two ago, showing a positive test result for COVID-19. And just to reiterate that test will be confirmed or will be sent to the Centers for Disease Control and Prevention for confirmation, but we will not wait on that await on that confirmation in order to begin our investigation.
Can I ask a question about when we might know where they went to the market, when they came back from the airport, what the kind of practical things that people might want to know if they were at Logan or at that airport at the same time, in the same bathroom, whatever. What timeline can you give us?
So that's part of the investigation that we're conducting currently, and when we have more information for the public, certainly if there's actionable information, we will share that. In terms of the time it might take to get confirmation from the CDC, that is a little bit unclear. It can take up to several days to get results back from the CDC from when they receive the specimen, and so we will be shipping that out today to the Centers for Disease Control and Prevention.
Molly?
This is for Governor Sununu. In your call with Vice President Pence later, is there anything specific you want him to know or concerns?
Well, I think it's a matter of understanding what the procedural operations are from the federal level, the opportunity to speak to other governors in terms of what they're seeing in their states, share some of those best practices. I was on the phone with Governor Phil Scott in Vermont just last night. We were talking about issues, not just what's happening within our borders, but also what's happening across the border. You know, the idea that folks may be flying into Montreal and then coming in through our northern borders in terms of, working with the Vice President and understanding some of the protocols and communication with our partners to the north, and making sure that, again, all those procedures that I think have been implemented here within the United States, I think they're being done very, very well, that those procedures are being mimicked across the border, and that there is communication to our friends there. And again, just as more cases of potential cases or real cases come online, just again having that communication with the other governors, sharing some of those best practices, what they're seeing, and being able to relay that directly down to the folks at Health and Human Services, Dr. Chen, Lisa, and their teams, to make sure that, again, we're just staying right on top of it. And then all of that will get kind of recommunicated. We'll be doing these phone calls, again, both up and down the chain with the public health managers at the very local level, with the federal delegation, of course, and making sure that, again, we all have that same information, because, again, communication, coordination, that's really going to be the most powerful tool we have.
Is the education department going to offer any guidance at all to schools around the state?
So there are, right now, I think, as has been reported, there were 3 schools that did travel overseas, that had students that were specifically traveling to Italy. I believe in all 3 of those cases, those schools have asked those students, those districts have asked those students to basically self-quarantine and stay at home for specific amounts of time that have been determined dependent on their potential exposure, depending on where they were and the time that they may have been over in Italy. In terms of the public health guidance, that really still comes out of Health and Human Services in terms of the what can and should be done for those individuals, and making sure the communication is seamless, again, whether it's in the Department of Education or Public Health. But the health-driven guidance still will be maintained out of Dr. Chen and the team at Health and Human Services.
Final question.
Yes, sorry.
Oh, and I just wanted to add, I think Director Daly told us too that your department's doing webinars with school districts, so there's
Yeah.
ongoing efforts
Yeah.
to reach out. Yeah.
When will the state be able to do its own testing for the virus?
We can do that right now. As of this morning, we're able to.
In terms of confirming, having the protocol to be able to confirm cases at the state level, which obviously would make for a quicker response.
Yeah. So just to be clear, and oftentimes in these types of situations, any positive that we get at the public health lab will need confirmation at the Centers for Disease Control and Prevention. So we currently have testing capacity. The confirmation is not going to delay our response in responding to this positive test. We're treating this like a positive, even while it's confirmed at the Centers for Disease Control and Prevention. But that will likely always be the pathway that any positive takes.
Thank you all very much.